Thank you very much, Chair Clyburn. This is a very, very needed um, hearing that you're doing today because there's so much information out there, a lot of it sometimes conflicting. And so I have a few questions that I really want to ask. First of all, let me thank Dr. Khan for his caution about CDC accepting information that they get from press releases. I've often wondered why they could adopt certain things so quickly and wondered whether or not the testing and the research had been done before they start to advise about 5-year-olds, et cetera, et cetera, et cetera. So I want to learn a lot more about that, but I thank him for opening up that discussion. Secondly, I want to get to the global problem that we have. And I want to ask Mr. Odayu Kumar whether or not we are assisting in any way to help other nations to develop their own vaccines. As I understand it, there is something in terms of international law that may be stopping them from being able to do it. Some of them want to do it. What do you know about that?
Sure. Representative Waters, thank you for that question. The U.S. is assisting several organizations around the world in trying to stand up vaccine manufacturing capacity. The format that's been used to date has included U.S. public sector investment from the International Development Finance Corporation, as well as working with U.S. manufacturers. So examples of that would include what was announced at the Quad vaccine partnership. So Johnson & Johnson partnered with Biological E in India with investment from the DFC and others to enable the production of 1 billion doses of vaccine over the coming year. We have also seen vaccines in terms of licensing, especially for fill finish capacity. We've seen announcements of Pfizer-BioNTech enter into such an partnership in South Africa. We have heard that Johnson & Johnson may allow manufacturing in its entirety. So the work that's happened to date has included voluntary licensing from our private sector manufacturers in partnership with the public sector, being able to help support everything beyond the intellectual property, the know-how, the access to supply chains, the regulatory advice and oversight, access to financial capital. And it's really that type of model that we need to continue to see. We most definitely need to increase the vaccine manufacturing capacity across low and middle income countries. And we have seen significant progress, including through a partnership for African vaccine manufacturing that's also underway. This is a space that is going to take some time, months to years, to stand up, given the complexity, but there's significant progress that's already being made.
Well, thank you so very much. And I would like to know, well, at one point, the Caribbean was begging the United States to help with the vaccines. Now, that was early on. Do we have that problem anymore? Because they had the money to purchase, but they did not have access, despite the fact that the United States had a memorandum of understanding with both Canada and Mexico. Now, are we in a position now where we can help others really and not do what happened with the Caribbean?
Yes, thank you, ma'am. We are in a much better position than we have been in the past, and the best position we've ever been in. As I mentioned, we see global output of more than 1 billion doses of high quality vaccines each month that will allow us in the US to make sure that we're following the science in terms of primary vaccination and boosters. We are not in a position of having to sacrifice any of that. But in addition to boosters as warranted in the US, as well as primary vaccination, we do have enough. We continue to send tens to hundreds of millions of doses internationally, and we need to continue to do that. Our recent analysis shows that if you look at the G7 and European countries, by the end of this year, in addition to everything they might need for domestic needs, they will likely have more than 500 million doses of excess vaccines. And those are the ones that absolutely have to reach low and middle income countries as quickly as possible.
Thank you so much. We have another problem I want to mention just quickly, and that is in Haiti, we got vaccines to them, and they could not distribute them. And so we had to make sure that we retrieve them before they expire. And we just need to come up with some ways of helping countries like Haiti. With that, I've used up all of my time, and I thank you very much.